The balance of power between human and virus is shifting. Better armed against a lesser enemy, our species no longer needs to hide in a bunker waiting for a viral wave to pass. That means it's time for our COVID response to change. As we enter the endemic stage of the virus, however, there is confusion about what an updated approach should look like. On Monday, Spanish Prime Minister Pedro Sanchez called for a Europe-wide discussion about developing the kind of response that exists for, say, the flu. The UK has extended its Plan B rules for another 3 weeks, but has softened its testing and travel policies, and Prime Minister Boris Johnson is under pressure to lift existing restrictions. It's too early to declare victory, of course. Infections are rising sharply, and there are still a worrying number of deaths from COVID-19. Plus, there are many regions where health services are under extreme pressure. And yet, the overall pandemic picture gives cause for optimism. Omicron infections in South Africa peaked about a month after the wave began. And data from South Africa and elsewhere confirm early indications that the latest variant, while far more transmissible, is causing less severe disease, with lower levels of hospitalization, shorter hospital stays, and fewer deaths. One explanation is that Omicron appears to affect the body differently than previous variants. A study from the University of Hong Kong Faculty of Medicine suggests Omicron may replicate in the lung more slowly than Delta, which would give the immune system more time to respond. Natural immunity also accounts for a lot. In countries where infection rates were relatively high in earlier waves, susceptibility to serious illness with Omicron seems much lower. A study published Monday by London's Imperial College, while limited by small sample size and a younger population, confirms earlier research suggesting that even immunity conferred from the coronaviruses that cause the common cold may help bolster defenses against SARS-CoV-2. Finally, we'll need to consider how much vaccinating to do beyond a third dose. With a virus of waning severity and rising levels of natural defenses, it's not clear we need an entire population to be routinely revaccinated after the third shot if the variants in circulation remain mild. It may be enough to offer variant-specific vaccines to over 60s and other vulnerable groups every 6 or 12 months while making further vaccination optional for others. Obviously, public health measures need to be under constant review. We must also continue to monitor levels of immunity and to test and sequence rigorously. Endemic doesn't mean harmless. Malaria and tuberculosis are also endemic in some parts of the world, and there were 627,000 malaria deaths and 1.5 million tuberculosis deaths in 2020. Long COVID, a complex illness where infected people suffer debilitating symptoms for months or longer, is another reason not to get complacent. Scientists have pointed out that there is nothing to prevent a more battle-hardened SARS-CoV-2 variant emerging again. But that risk doesn't justify long periods of costly restrictions right now. Levels of vaccination and immunity, and access to hospitals and treatment, should determine levels of restriction, not infections. Endemics demand different responses, as do milder diseases. This isn't a return to the false dichotomy of lives versus livelihoods from earlier waves. The virus has changed, as have our defenses. At the moment, the bark of SARS-CoV-2 looks worse than its bite. We'd be wise to adjust accordingly.